One of the things that I've been acutely aware of through some of the research I've done is actually the racial and socioeconomic differences in patients and uh, how they might receive care and what their perceptions of care have been. Um, I find that there's bias on all sides of the fence. There's bias on the patient side because they might think that they don't understand what we're necessarily doing with our treatments. They might not have the education level to understand what we're doing. Maybe they had a friend or a loved one or somebody in their community who's been vocal about their unhappiness about their treatments or what have you. On the clinical side of things, on the physician side, because of the insurance barriers, a lot of times we're handicapped to take care of patients in a proper way. Sometimes we're waiting a day or 2 days, for example, for insurance approval for something we'd like to treat today. And so that leads to some barriers on our inability to take care of all racial and socioeconomic situations. Because sometimes, and a lot of times, those go hand in hand. They're not really, I think, separatable in many ways. Sometimes they go hand in hand. That race and socioeconomic factors are interplay with each other. So I think as part of my role as an educator, I talk to my residents and my fellows about being culturally and racially and socioeconomically sensitive to my patients as a way of engaging them in the process. Not um, being understanding of their background or their education level or their understanding of their disease state to make them understand the importance of the disease. So we might spend some more time with some of those patients to make sure that they understand why we're doing the treatments, what the value of the treatments are, how we can help enable them to come to their visits, because they might be facing some economic barriers to coming to us, and we may not know that. And I think that that's a very, very important thing we can all do as clinicians with our patients every day.